Hello friends, I am Dr. Sandeep Bhasin from Carewell Medical Center. Today I will be showing you how we do a marking for a breast implant case. We are doing this marking for a patient who wants a silicone breast implant. So we'll be showing you these markings and how do we decide what plane do we put our implant, the size of the implant, how do we determine on these markings. This will be based on the TEPID score. So let's start. How do we do the marking? Let me show you and demonstrate to you. Okay friends, we are starting now the breast markings. We have marked the midline and the distance from the nipples to the midline. What you have to see first is the symmetry on the right and the left breast. And here they are symmetrical. The equal distance from the midline you see from midline to nipple is 22 cm on both the sides. So both nipples are on the same level and the breasts are also symmetrical. In this case, the only thing is the right nipple is a little more lateral as compared to the left nipple. So what we have to tell to the client is that one implant, the right side would be a little more lateral as compared to the left side. There is a possibility of that. So we are telling to the client and explaining this may happen, that one implant right side may be a little more lateral as compared to left. We are explaining this to the client. Now we are looking at other criteria, and now we are going to look into the inframammary fold. From nipple to inframammary fold in this case is 4 cm, which is less. Normally it should be about 6 cm. So we have created a new inframammary fold line which is about 5.5 cm from the nipple. Now our incision is also on this line, and we keep 2/3 incision lateral and 1/3 incision medial. And we can see that this new inframammary line is a very important landmark for our putting breast implant. It indicates the new shape and the new inframammary plane area. Now we are going to decide which plane we have to put the implant. Now for that we have to look on superior pole thickness with the caliper we are measuring now. See, this is the caliper we are measuring. The superior pole thickness in this case is less than 2 cm, which indicates we have to put the gland in the subdual plane or the subpectoral plane, not in subglandular plane. This is because if the superior pole thickness is less, we should be putting it deeper. Similarly, inferior pole thickness here is less than 0.5 cm, which again indicates that we have to put the implant in the subdual plane or the subpectoral plane, not in the subglandular plane. So this is how we decide the plane of the implant. Now let's look at another thing, the breast width. This is the breast width, which is about 13 cm, and after excluding the pinch test on either side it comes to 11.5 cm. This is the breast width. According to TEPID score, the volume of implant that we can put is 270 or 280 cc implant can be put into this breast. Another thing is the intermammary thickness or distance. Intermammary distance should be ideally 3 cm to prevent synmastia and to maintain a cleavage plane. So we limit our dissection, medial dissection up to this point and do not come closer than this point. So these are a few things we always keep: the intermammary fold, inframammary fold thickness, intermammary distance, and these are the things that we always keep in mind when we are doing the breast implant, so that we get the best results in our breast implant. Okay friends, we have seen how we do the markings in case of breast implant. There are few very important things as we discussed. First, we must always look for the symmetry on the right and the left breast. Are they same or any difference? Are the nipples on the same side? Are they more lateral? Any nipple more lateral? The other thing we have to always look for is the distance between the nipple and the inframammary fold. We try to maintain about 5 to 6 cm from the nipple to inframammary fold, and this decides our incision site also, because we make our incision at the inframammary mold markings. The other thing is we have to decide the plane of the breast. The plane of the breast is decided whether the superior pole thickness is less than 2 cm or more than 2 cm. If it is less than 2 cm, then we put our implant deeper below the muscles. If it is more than 2 centimeters, we can put it below the breast gland also. So this is something we must always know. The size of the implant we decide upon the breast width. If the breast width after all calculations comes something like 11.5 centimeters or 12 centimeters, then we go up to 270 to 300 cc implant. This we decide according to the Tepit's coding. So this is how we decide the size of the implant. So by the marking we come to know the size of the implant, the position of the implant, how do we, the marking of the incision, where we give the marking of the incision, and also we decide the medial extent of our dissection and the upper limit of our dissection, the lateral limit of our dissection after these markings. So the marking in a breast implant is a very important. And thank you friends, I am Dr. Sandeep Bhasin. Once again, hoping to see you sometime in future. If you like my video, please subscribe my video or like my channel so that we can upload more such videos for education for our colleagues, friends, and also for the clients to understand how breast implant is done. Thank you.